رمضان 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 يا حبيب رمضان رمضان ليتك دوما قريب.
We know that for every situation we find ourselves, there is an atom of either excitement or regret. Whether it's excitement, whether it's regret, there's every possibility that either of the situation might bring the topic of discourse.
People of all ages can suffer from depression. It does not have age limit. That a particular person, probably an elderly, should be the one suffering from what we are talking about. People from all ages can suffer from depression. But the highest rate occur between the ages of 25 to 45 years old. Ages of 25 to 45 years, mostly. It does not mean those that are above that age will not come down with depression, or those below the 25 can't come down with depression. The rate of depression is not affected by ethnic group. Bóyá Yorùbá ni mí, bóyá Hausa, bóyá Igbo, kò ní nǹkan ṣe. Level of education, kò ní nǹkan ṣe. Income tí mo rí lẹ́nu iṣẹ́ mi àbí bí ọjà mi ṣe ń tà sí, kò ní nǹkan ṣe pẹ̀lú pé kó jẹ́ factor pé kí wọ́n fi ní depression.
Marital status. Depression is the most common psychiatric disorder. Thomas of psychiatric. It does not matter that if that person is insane.
A sane person will do something normal. An insane person will do something and say, kò gbádùn ni. It does not necessarily mean when that person is insane. For a depressed person, there is a limit at which your sanity can carry your thinking. Since that person is in a depressed mood. It's a common psychiatric disorder. It affects 10 to 25% of women and 5 to 12% of men at some point in their lives. It means àtọkùnrin, àtobìnrin can be in that condition, can be in a depressed state. What can cause depression? The main causes of depression is not known, but can be triggered by so many other things. But you cannot say, for like malaria now, you say when you are being bitten by female Anopheles mosquito, you come down with malaria. For yellow fever, they will say when you are being bitten by Aedes aegypti mosquito, you come down with yellow fever. But for depression, you cannot say this is the what? The causing factor. This is the receptor. This is the rodent. This is whatever you can attach to any condition whatsoever that can be managed. You cannot say this is what causes it particularly. There is a genetic association and relative of people who have had depression, manic depression, or alcoholism are at higher risk. Alcohol or drug abuse can cause symptoms of depression and can sometimes certain prescriptions can bring one into a state or mood of depression. You just have mood switch based on one particular drugs or medication you are taking. That is why it's not always very advisable. Nígbà míì a kì í gbà á láyè, a kì í fáwọn èèyàn nímọ̀ràn ní pé nítorí pé lágbájá ń lo oògùn kan ó ṣiṣẹ́ lára ẹ̀. Ìwọ náà gbọ́dọ̀ ṣe kí ni? Ìwọ náà gbọ́dọ̀ ra irú oògùn yẹn nítorí pé n tó ń ṣe ẹ́ ó fẹ́ jọmọ́ n tó ń ṣe nìyẹn. Ó wá lọ rògùn tẹ́nìyẹn ń lò, ara ẹ lè má gbà o. So certain drug prescription can leave one in a change switch mode. Such as prednisone and some other blood pressure medication. For those that are hypertensive, sometimes when you see that you use some of your medications, it changes the system entirely. For the time being, tẹ́ni ẹ bá fi lògùn yẹn kò ní tí get ara ẹ̀ until some hours later, ni ẹni yẹn ṣẹ̀ṣẹ̀ máa balance padà. ló máa sọ pé oògùn yẹn tí n bá ti lò ó máa ń ṣe ara mi bákan bí kí ó ṣe báyìí pé òyì ń kọ́ mi bí kó dà ń pé mo fẹ́ sùn bí ẹni pé mi nílé control ara mi ṣá tí n bá ṣá ti lògùn yẹn bọ̀ lẹ́yìn àwọn àsìkò kan tẹ́ni ẹ ti lògùn yẹn ó máa padà ṣe kí ni ara ẹni ẹ máa padà sípò. Various medical conditions such as hyperthyroidism, system infection, congestive heart failure, autoimmune disease. Some of our autoimmune disease, we can talk about HIV. It's an immune suppressant. When the virus enters into the system, it kills the immune system and allows all other opportunistic infection. Opportunity, don't have to say opportunistic. Nǹkan yẹn lo ìgbàláyè ń pé bí ń sìn tí wọ́n bá ṣí géètì yìí lẹ̀ anybody tó bá ń lọ ní iwájú géètì yìí tí ò ní nǹkan ṣe inú ilé ìṣó máa wọlé. Bọ̀bọ́ yẹn ṣí géètì yẹn lẹ̀ ẹni tí ò ní nǹkan ṣe inú ilé yìí náà ń gbà mí tí ò rí irú ilé yìí rí tó bá kọjá ní àdúrà ní tí wọ́n kọ́ sínú bírè ṣe mọ̀ pé distraction wà ńbẹ̀ yẹn opportunity pé wọ́n ṣí géètì yẹn lẹ̀ ó ṣe kí ni ó ráyè wo lùbí. The same thing náà ni autoimmune conditions ṣe rí tí immune system wọn bá ti wà suppressed àwọn àrùn kéékèèké tí ò yẹ kó wọnú ara tẹ́lẹ̀ wọ́n á ṣe kí ni wọ́n á fa àǹfààní yẹn wọ́n á fi wọnú ara. Neurological disease and can also cause symptoms of what? Depression. A difficult or tragic life circumstances. Ẹni ẹ ti ń ṣiṣẹ́ tẹ́lẹ̀ ó lost iṣẹ́ ó níyàwó ó lost family ó ṣàpàdánù nǹkan kan tó wà very very keen to the heart n tó hó gan tó díẹ̀ sí gan ó sọ nǹkan yẹn nù irú ẹni bẹ́ẹ̀ can go into a depressed condition because this is what might trigger the effect in the system. Kí ni àwọn kan tá a lè rí that's symptoms tá a máa fi sọ pé ẹni wà depressed. The main symptoms of depression is either a depressed or saddened mood, the inability to enjoy things normally. Gbogbo ohun tó ń ṣe tẹ́lẹ̀ tínú ẹ̀ máa ń dùn láti ṣe wàá máa ṣe pẹ̀lú ìnira bí n pé wọ́n ń force ẹ ọmọdé láti school sí wọ́n fẹ́ ṣe assignment ẹ wá dẹgba mú oúnjẹ wà ńlẹ̀ ẹ wá ní tó bá ti ṣe assignment yìí tó ò ní jẹun o ẹ dẹ̀ gbóúnjẹ lẹ̀ ìwé wà ńlẹ̀ ibo lọ́kọ ẹ máa wà nú méjèèjì kódà kan kẹ mẹ́gbà yẹn kẹ ná dáadáa ó yìí máa wo oúnjẹ yẹn lójú pé oúnjẹ ló yẹ kán jẹ́ kí n kọ́kọ́ jẹ kí n tó wá ṣe assignment yìí. So something will trigger that effect in that person nítorí pé ó ti ní àwọn ìpèníjà kan tí ó ti ṣe kí ni tó ti mú ìrẹ̀wẹ̀sì bá ọkàn ẹ̀ ẹni yẹn ti ní àrùn ọkàn already. One of those things tá lè rí nínú ẹni bẹ́ẹ̀ ni pé sleeping problem ẹlòmíì ò ní rórun sùn rárá ẹlòmíì máa sùn yẹn á ní tóun bá sùn oorun òun ò kí ń dọ́kàn ẹlòmíì ò ní rórun sùn bọ́ ẹlòmíì máa sùn ṣùgbọ́n oorun tó ń sùn náà tún máa pọ̀ jù. Àìrórun sùn àti sísun oorun yẹn kó pọ̀ jù is part of those symptoms. Eating little kí èèyàn má lè jẹun jù àti kí èèyàn wá jẹun yẹn kó wá pọ̀ jù is another part of it. Difficulty in concentrating or making decisions. Ohun tó yẹ pé normally òun ṣe tí ò ní ẹ lára wà wá find it very difficult láti ṣe. Difficulty in concentrating. O ní wà focus lórí nǹkan yẹn. Then tí wọ́n bá fọ̀rọ̀ lọ ẹ́ you find it very difficult to make a decisive decision. Wọ́n lè máa sọ kí n tó ń sọ yẹn kó má bá n tó máa fún wọn response lọ. Decision making, there is always what? Defect in your level of focusing and decision making. Then fatigue, ó máa rẹ nìyẹn. Feelings of guilt or worthlessness. Wọ́n máa fi ń pé bóyá ó ní nǹkan kan tó ti ṣe kan tó yẹ pé òun ló ń dà ẹ́ láàmú. Or wàá máa fi pé bóyá life existence ẹ ó wà worthless ń pè wọ́n fúnra rẹ̀ gan o ní nǹkan gidi kan tó fẹ́ gbé ṣe. Feeling physically that sound slow or speed up. Probably you are not too okay to do some of those things you are doing. And when you are doing that thing, you are too slow at doing it. If level of excitement is too high, you do those things as fast as possible as you thought you would do it. Then recurrent thought of death or wanting to die. That is why you will see on occasions, you will see on social media, you see somebody that will just stand on Third Mainland Bridge. People will now be begging that person. Bàbá kí lẹ ń ṣe ń bẹ̀ yẹn? A ní òun jẹ gbèsè ni. Ilé ayé yóò tẹ̀ yé òun mọ́. Ṣé ló dà ń pé òun nìkan ní ilé ayé kẹ́yìn sí? Ètò tó wá jàjù fóun ni pé òun kú parí ilé ayé yìí síbi tó ń wá yìí. Á dẹ̀ bẹ́ sómi. It happens like that and we read online. There is this DSS lady, not quite late last year, that they said he has an intense argument with his fiancée on the phone. And he had the driver who came home to pick him, to drop by Third Mainland Bridge. Oh yeah, I drone me. And the driver waited. The lady jumped into the lagoon because she was trained, so she dived in. And that was her end. I never heard maybe they've seen her dead body up to now. These are some of those things that come into mind for a depressed person. Let me end it. That is just it. Then diagnosis. How do we diagnose somebody having this condition? A depressed person. Diagnosis of depression is based on the presence of a combination of the common symptoms. Tàbá interrogate the patient, interrogate ẹni yẹn. Tí gbogbo ń tà ń béèrè yẹn jọmọ́ tó ń sọ fún wa, a gbọ́dọ̀ máa ṣàkíyèsí. Absence of medical disorder or medication side effect. Tó yẹ pé kò ṣoògùn ló fà á. Kò dẹ̀ ṣe ń pé bóyá ẹni yẹn ti ní condition kan rí tẹ́lẹ̀ ní nǹkan yẹn fi wáyé, a máa suspect. Tó yẹ pé substance abuse ni ẹni tó ń lo oògùn olóró. Tàbá most of our youth wá ń sìn. They'll say, ojú lásán ò ṣeé ṣe gbogbo nǹkan until they get themselves drugged up. They drink so many things. They smoke so many things. I was at a program and when I got down from the vehicle, the first guy who came to meet me was, Alaye, Shefera loud to me. I was not asking the person, please, what is loud? He said, Akole yeyin. Ó dà ń pé irú yín kọ́ la fẹ́ tà fún. Refnol and some of those medications. Those medications turned poison drugs because of abuse. Some people are making their means of livelihood from all these things, and they are killing the life of youth and those that are taking them. Adequately, some of these things will spring up when that person is on a long-term use on some of those medications, or somebody who abused alcohol. There is no specific test that can be used to detect depression. Nípa okay, wá lọ hospital, doctor wa ní ẹ lọ ṣe test báyìí ká lè fi mọ̀ pé wà depressed kò sí. It's the process of clinical investigation, the process of taking history from the patient, the process of examination, the process of history taking. We make the person attentive to that person knows that probably the person is suffering from depression. What are the complications? The most severe complication of depression is suicide. That's the severe complication. Suicide. Kẹ́ni ẹ fẹ́ parẹ́ àbí kó parẹ́. Àti gbọ́rí pé ńgbà tẹ́ni ẹ rò tí ò rí rò. Ó dẹ̀ tan fáànù nínú ilé ẹ̀. Ó pa fáànù. Ó dẹ̀ sokùn mọ́ fáànù. Ó dẹ̀ ṣe kí ni? Ó dẹ̀ hanga rẹ̀ mọ́. Stúdù tó gbẹ́sẹ̀ lé. Ó dẹ̀ tá ń pa á. Ó ṣe kí ni ó hẹ́ǹdì ẹ̀. Ibi tó rò bóyá òun lè parí ẹ̀ sí ló rò sí yẹn. Bó ṣe rò bóyá òun parí ẹ̀ sí ibi tó rò bóun parí ẹ̀ sí yẹn, ìjìyà ẹ̀ ṣẹ̀ṣẹ̀ bẹ̀rẹ̀ ni o. Òun àtọlọ́run, ìjìyà ẹ̀ ṣẹ̀ṣẹ̀ bẹ̀rẹ̀ ni. The most severe complication of depression is suicide. the possibility of which makes depression potentially fatal illness. That suicide thought, suicide attempt is what made depression fatal. Less severe but more common are impairment of one ability to work and interact socially. Ẹni tó ní ìgbéníjà ara àti ìgbéníjà kankan, bóyá ẹni tí kò ríran ni, àbẹ́ni tí ò rẹ́sẹ̀ lóní, tó ti ń lo àwọn nǹkan yẹn tẹ́lẹ̀ tí condition kan wáyé tí ò rí àwọn nǹkan yẹn lò mọ́. Irú ẹni bẹ́ẹ̀ nígbà míì á máa rò pé ibi tí decision òun yẹ kó pin sí ni kó ń ṣe kí ni kó ń gbẹ̀mí ara òun. Impairment, somebody who lost the job, I've said it before, who missed the fact that he's always a workaholic. Ní pé òun lòun wá wà lẹ́ni tó ń jókòó sójú kan. Somebody who is severely ill, who thought the best position, the best solution is for him to die on that sick bed. Somebody who could not mix with other people outside again. Somebody who had an unstable marriage. Somebody who had social isolation. During the time of COVID, some of us, we are being asked to stay at home. We find it very difficult. Some who had jobs to do before were relieved of their responsibility. Àsìkò COVID ẹni gọ́ọ̀mẹ̀ntì àbí iléeṣẹ́ aládàáni míì ni wọ́n ní káyọ̀ lómi ìjókòó sílé wọn. Nípa àwọn lè take care staff strength yẹn mọ́. Ẹni tó ti ń lọ láàárọ̀ tó ń dé tó ń rìn kan múlẹ̀ lóṣù tó wá dín kó yẹ̀ṣẹ̀ ń wọwọ́ kó tó jẹun. Irú ẹni bẹ́ẹ̀ is part of the complication that can bring that person to a depressed situation. Kí ni treatment tó jẹ́ self-treatment tí ẹni tó bá wà depressed yẹ kó sought after? Reducing or eliminating use of alcohol fún ẹni tí Ọlọ́run kò sí lọ́kàn ẹ̀ tẹ́lẹ̀. We feel when we drink and drink and drink, that person feel at the state of being drunk. Worries òun ṣe kí ni? Kí ni worries ẹ ṣe? Worries òun ti lọ. But tó bá mú nígbà tí ọtí ẹ̀ máa tó ká lójú ẹ̀ kí ló máa padà ṣe? Worries yẹn náà àtúnṣe kí ni? Body yẹn á tún padà. Somebody who has been on a certain medication tó ti ń abuse the medication yẹn, such person should desist from that act. Sedatives, ẹ̀mí lè sùn lásán tí mi bá ti lóhun tó máa mú mi sùn. That person is abusing the medication. Sought after a medical person. Eating properly is part of those things you can do to make yourself healthy. Getting regular exercise. Using the appropriate therapies for any medical conditions. And one of the best things ever, as part of those things you need to do, is that you need sought after a psychologist, a psychotherapist, a neurologist. These are those people that can work on your what? On your condition. Medical treatment. Psychotherapy and antidepressant are the medication that can be used individually, and sometimes you can combine both. When you say psychotherapy, psychotherapy is the aspect of talking somebody out of a condition. Àwọn àfáà ló máa ń ṣe ètò pọ̀ jù nínú psychotherapy yàtọ̀ sí pé tó bá lọ sí hospital, because lecture tó ń fẹ́ ṣe fún ẹ wọ́n á fọ̀rọ̀ Ọlọ́run bọ́ ẹ, wọ́n á jẹ́ kó understand pé n tó rò bóyá òun là kọjá yẹn ó ti ṣe àwọn ẹlòmíì rí, kò ṣe wọlé èèyàn àkọ́kọ́. Tó bá sọ pé ibi tiẹ̀ dé ló ṣe fẹ́ pin ẹ̀mí ara ẹ, wọ́n wá jẹ́ kó mọ̀ pé n tó sọ pé ibi tiẹ̀ ti dé yẹn, ibẹ̀ ni condition àdánwò ẹlòmíì ti ṣe kí ni ló ti bẹ̀rẹ̀. Tó yẹ pé tó bá wá rí rònúròní níwọ̀nba n tó ṣe yẹn wàá ṣe kí ni wàá máa ṣe alihamdulilah. Iṣẹ́ ìtópọ̀jù yẹn àwọn àfáà lónìí. Àwa náà a máa ń ṣe nítorí pé ẹni tó bá gbé condition yẹn wá á ṣe kí ni á bá sọ̀rọ̀ tó pọ̀. The process of doing that is what is called what? Psychotherapy. Then medication being used, antidepressant. The antidepressant is the medication you use for somebody that is what? Depressed. Then you can take both the psychotherapy and the medication as a way of attending to one particular person. Ẹlòmíì ò ní ní ìdògùn, ọ̀rọ̀ lásán ló máa fẹ́. Ẹlòmíì ògùn gbẹ́dọ̀ wà ń bẹ̀ àti pé o tún ṣe kí ni, o tún gbà níyànjú. The medicine are commonly used for depression are selective serotonin reuptake inhibitors, SSRI, such as fluoxetine and tricycline. These are some of those. Tricycline is part of those antidepressants. I'm not saying because I'm saying it. Somebody will say they will go and buy it. And also amitriptyline. You have to see a medical officer, a doctor, to review you before they can place you on medication. Don't say mo ní ẹ̀kan tí ẹni yìí ń sọ tó ń ṣe ń lé o. Ògùn tó ń dẹ̀ dárúkọ yìí, wàláì má dẹ̀ lọ rà fún. It is not your work to do that. We are only what? We are only educating ourselves. Severe depression that is not manageable with medication is occasionally treated with electroconvulsive therapy. Ìtógùn ò bá gbọ́, tí bíbá sọ̀rọ̀ ò gbọ́, electroconvulsive therapy. Wọ́n wá lo electric impulse fún ẹni yẹn. Bí a ṣe máa ń fi electric charge battery, tá à ń fi electric charge àwọn kan fóònù wá ń sìn tó bá down, kí la máa fi charge ẹ̀? Iná. Kódà kan kò ní power bank, ìkan kan ló máa fi charge power bank. So àwa fi iná charge brain ẹni yẹn, a fi charge ọkàn ẹ̀. That's anti-what? Electroconvulsive therapy. La máa lò láti fi ṣe correction. So preventive measures, kí ni àwọn kan tó yẹ ká ṣe láti prevent depression. Depression is difficult to anticipate. But those who have a family history should be acquainted with the symptoms. That is to tell you that there's every probability, even though when you don't fall into conditions that make you depressed, if it is in your family, it is probably you what inherit it. So if you are the type that knows that it runs in the family, try and start reading about it. Start checking about it. Start asking questions that bothers your mind to clear those things out of your what? Out of your memory. By seeking professional help promptly at the hint of suicidal thoughts, tó bá ti ń wá sọ́kàn yín pé kí n tiẹ̀ lọ kó sẹ́nu mọ́tò. There was this time when we were in school. The lady was having issues at home. Her academics was not going well. The next thing, they just saw that she left the class and was going towards the express. And lecturer was still teaching them. Those who saw that she stood up was like, what is wrong with this lady? So they sought after her. She said, ẹ fi mí lẹ̀, ẹ tẹ̀ jẹ́ kí n lọ hand díẹ̀. Why? Because kò rí bí ṣe kí ni, kò rí bí gbé sí. Tí a bá ti rí pé irú èrò kèrò báyìí máa ń wá sọ́kàn, ẹ jẹ́ ká sought after àwọn tí wọ́n lè ṣe kí ni, tí wọ́n lè bá wa sọ̀rọ̀ lórí ẹ̀ títí di extent tí nǹkan yẹn máa fi ṣe kí ni, tó máa fi kú lára. When you have this prompt at the hint of suicidal thoughts, seek for help. Strong suicidal impulse warrants an immediate visit to an emergency department. Kò ṣe ẹni tí mọ́tò gbá nìkan ni wọ́n máa ń gbé lọ sí emergency room. Ẹni tí ní pé thought ní pé kó ṣáà tán báyìí, báyìí pé n tó gba ọkàn ẹ̀ kan nìyẹn, òun náà nídìí kó wà ní emergency situation. Kí wọ́n attend sí as fast as possible. Mo rò bóyá gbogbo ohun tí a sọ yìí, a ti rí nǹkan bíi méjì láti dìmú. Torí pé ilé ayé fúnra rẹ̀ challenge lọ́lọ́run fi ṣe fún wa. Eré ìje ni. Tó bá bẹ̀rẹ̀ tó dé stage kan tó rí mú, tó bá dé stage kan wàá jùlẹ̀ tó bá wá ń rí mú lọ tó rí jùlẹ̀ tó bá tásìkò kan Ọlọ́run máa ní kí títán dé á jùlẹ̀ tọ́lọ́run bá ní ká kú wọ́rọ́wọ́ bọ́lọ̀ ń ṣe mú wá nìyẹn ṣùgbọ́n ẹlòmíì máa jẹ̀rora ni á jẹ̀rora àìsàn. These are some of those things. Sometimes la máa rí pé ẹlòmíì tó wà lórí ìdìbò láìsàn máa ń bẹ Ọlọ́run fún ikú nítorí pé àwọn pé ìnira tó ń go through yẹn ó pọ̀ ju ti ara òun lè gbé lọ. Kò wá sí ní ta lè máa go through, the only person ta lè sought after lọ́lọ́run. Lẹ́yìn Ọlọ́run a lè wá sought after àwọn medical doctors nítorí pé Ọlọ́run ní kí wọ́n kọ́ṣẹ́ mọṣẹ́ lórí àwọn nǹkan yẹn. Wọ́n á wá direct yín lọ sọ́dọ̀ àwọn tó yẹ pé iṣẹ́ wọn gangan ní situation tí wọ́n là kọjá yẹn. Ẹlòmíì ó kàn nídìí kéèyàn wà lẹ́yìn ẹ̀ láti máa fún lọ́rọ̀ ìṣítí ni láti máa support ẹ̀ láti motivate ẹ̀. But the first motivator should be yourself. Motivate yourself first. What all other person will do after will only add to what is on your mind. À ń bẹ Ọlọ́run nínú àánú ẹ̀. Gbogbo ohun tí ẹnìkankan wá lè máa là kọjá k'Ọlọ́run jọ nínú àánú ẹ̀ kó gbé wa borí ẹ̀. Kó wọlá nínú oṣù tá a wà yìí. Ibi tí bá ti ń tẹ ẹnìkankan wá lẹ́sẹ̀ k'Ọlọ́run bá foróró tura sí. Subhanaka Allahumma bihamdika ashhadu an la ilaha illa ant astaghfiruka wa atubu ilayk. Assalamu alaikum warahmatullahi wabarakatuh.